because all the other exercises and everything we do further down the line is going to make so much more sense. And I would argue that most physical therapists never explain this to you. So if that hasn't been the case for you, I'm sorry. I'm glad you're here now. We're going to talk about it. Hey guys, what's up? Welcome back to another episode of Unchoreographed. I'm your host, Dr. Jenna Lower, and today I want to talk to you about something that I think a lot of you are probably struggling and have been up late at night Googling away. 3 reasons why you may still be in pain after you've had labral repair surgery. And these are things that your doctor or your surgeon probably didn't even mention, but they are the things that I see, the top 3 reasons that I see people still in pain. And I don't want to say failed surgery because I don't think that's what happens. It's just that maybe your body didn't respond in the way that you were hoping or that you thought it would respond. Many people go into a labral repair surgery hoping that this is going to cure the problem, that they're not going to be in pain anymore. They're going to be able to move the way that they want to move and do all the things that they want to be able to do again. And what I find is that for many people, that isn't actually the case. For a lot of people, they end up, I don't want to say that they're in worse position than when they started, but they're not back to doing the things that they were hoping they would do, that's for sure. And I think the majority of my clients just end up feeling so defeated when this happens because they put a little too much stock in hoping that that surgery was going to solve the issue. And for many, it just doesn't. And I don't think that it's because the surgeon did something bad or because it failed. I just think that there's a few things that may best beforehand to set up your expectations of what the recovery on the other side would look like. And so that's what I want to talk to you guys today about. So we're going to dive into the top 3 reasons you are still in pain if you had labral repair surgery. Reason number 1. This is without a doubt, I did put these in order of what I think significance is. I think without a doubt, this is the number 1 reason that I see this being a problem for people. Surgery will fix the structure, right? So when we look at impingement and labral tears, yes, there is often a structural component to this. You may have had a cam impingement, a pincer impingement, a mixed, a little bit of both, and a labral tear. Maybe you have the cam or pincer morphology, but you don't have the labral tear. Like there's something structural happening within there, right? Surgery can fix that. Surgery can go in and they can shave down the bone and they can shave out the piece of the labrum that is torn, and they can, sometimes they don't repair them often anymore, but sometimes they'll repair it. Like there's different things that they can do from a structural standpoint. However, hip impingement and labral tears are not just a structural problem. In fact, much of the time, it is actually a mechanics problem combined with a structural problem. For some people, the structure isn't even the reason that you're having pain. It's the mechanics. And so what happens is you fix the structure with the surgery, but if nobody has ever done anything to teach you how to correct the mechanics, you are still going to be in pain. It's not going to solve the issue. And I think this is huge from an expectation standpoint, that if nobody's ever explained this to you, you are expecting the structure is what's causing my problem. I'm going to have surgery and I'm going to come out on the other side and it's not going to hurt anymore. The structure that was causing my pain is no longer there. So problem solved, right? Not right, especially because oftentimes the structure isn't actually what's dictating your pain. It's the way that you're moving and mechanically everything is working inside of that joint. So a good example of this is they will do research studies all the time where they look at normal, healthy hips that, or I shouldn't say healthy, asymptomatic hips. So people that have no symptoms, no pain, nothing. And they will take MRIs of both of their hips. And they have found that in up to 60 to 70% of asymptomatic hips, that they actually have a diagnosable structural finding on their MRI. That could be, a cam or a pincer impingement. It could be a labral tear. But these people are living with no pain or symptoms. So what that tells us is that a large percentage of the population is walking around with these exact same structural problems that you maybe had surgery for, and they're not having any issues from it. So how can we be sure that the structure is actually what is causing the problem? And again, if it's not, surgery is not going to fix the problem. Now, for the majority of the clients that I work with, I find that they're able to delay or avoid surgery. This does mean that these people are willing to learn how to manage what they are struggling with. I am not anti-surgery. I think there are cases where surgery is warranted, and there have been times where that has been the outcome for sure. It's not all of my patients, right? There are times where surgery is the right solution. I'm not going to argue that factor, but what I am going to argue is that unless you have done everything in your power conservatively and worked with a therapist who really understands hip impingement and can really understand how to adjust your movement and your mechanics and teach you how to manage this, that unless you do that, it is not worth having surgery, because you cannot be certain that the structure is actually what's causing your problem. So the majority of my clients that come in, I can pretty quickly, within the first visit, tell if I think surgery is going to need to happen or not. And that comes from experience and knowledge in the area, and also kind of looking at some tests and things that I can essentially adjust their hip in certain positions or ranges. And if I can take their pinching away and their discomfort away, that's a pretty good sign to me that it's not the structure that's causing the problem. It's how they're moving. So for instance, hip flexion, so pulling your knee closer to your chest. Maybe that hurts in a open chain position. So what that means is like when your foot's not planted on the ground. So think of lifting your foot up to put it on a stair, lifting your leg up to put a shoe on or a pair of pants. That's hip flexion. For many people with impingement and labral tears, that is a really aggravating activity. It brings on symptoms. However, when I put them on hands and knees and I ask them to do a simple rock back, which is also hip flexion, but in a very different way of doing it, I'm not having to lift my hip against gravity anymore, but I'm still flexing. Majority of them can still go through that range of motion and it is pain-free. Now, sometimes we have to make little adjustments. How you're moving, how you're holding your hip, maybe turn your toes out a little bit more, tuck your pelvis, untuck your pelvis. Like there's little things that we can do. But the majority of time I can figure out if I can adjust somebody out of feeling pain through a hip flexion motion, that very often is somebody that is not an ideal candidate for surgery, at least not right now. Because it proves to me that the structure is not preventing them from flexing their hip. They can do it when they're not against resistance or against gravity. But as soon as they do it in standing, something's off. Maybe it's when they flex, like go to put their pants on. Maybe it's when they're squatting. But I know they can get their hip past 90 degrees because they already showed me and it didn't hurt. It tells me that the way that they're coordinating in standing and functional movement is not correct. And that is what's contributing to the excessive stress and tension in the joint that's ultimately what's creating their pain. If we can address that and we can fix that component, very often, number one, surgery is not going to solve the issue. Number two, it's going to avoid the need for surgery. So this is so important to me to explain this to you guys, because when I have a client that reaches out to me and they're like, should I have surgery? Shouldn't I have surgery? And we do this assessment, very quickly into that assessment, they're like, oh my gosh, I never thought, nobody has ever explained it to me this way. My doctor literally just told me that the bone is in the way. They didn't explain that if I'm moving differently, the bone's not in the way anymore. All these different things, right? It's so crucial that you guys understand this. And that's why I'm so passionate about doing things like this podcast, to bring this education to you, because I want you to exhaust the conservative care options first. Going into this surgery, it's not an easy recovery. It's not I had it, it's instantly better, it's done. For some, yes. I'm sure there are some of you listening to this that you're like, well, that's not my situation. I had surgery and it got better. Yeah, that's awesome if that's happened for you. I truly, that's amazing. The vast majority of people, though, that is not the situation. And you can take one scroll through TikTok and see what I'm talking about, because the comments that I've seen on these posts that I see, my algorithm talks to you. And so I get a lot of these. And it is people after people saying, I had surgery, I'm still in pain. Anybody else? And the comment sections are just flooded. Mine too. I thought it was just me. I can't believe now my other hip hurts more than this hip. Nobody explained. It's crazy, guys. But nobody ever explained it to you in this way. So if you think that just changing structure is going to solve the problem, you are sorely mistaken. And I really want you to understand that before you get yourself into such a major surgery. The other little thing with this is to keep in mind, so again, there's structural and functional impingement. Structure is the bone, the bony stuff that we can't change from the outside without surgery. And the function is the movement piece. Most cases of structural impingement where there actually is a bony change also has a functional component. Now, it's really hard to say, is the function what created the structural problem? What came first, chicken or the egg? Because when we move in such a way that the head of the femur sort of butts up against the front of the socket, that repetitive stress, which again can come from faulty mechanics or alignment, and just understanding how to move, right? So that the head of the femur kind of hits the front of that socket, bone-on-bone contact. What that actually creates, there's something called Wolff's Law. Wolff's Law says that areas of stress on bone will actually lay down more bone to heal and protect itself. So this is extremely important for things like a fracture. If we want a fracture, we want bone to regrow. We want it to be stronger than it was before. It's going to create that union and everything's going to be good. Well, in a case like impingement, if we're getting repetitive stress over time, that repetitive stress, your bone is going to start laying down extra bone. And now you might end up with a cam or a pincer impingement. So what came first, the chicken or the egg? The movement or the structure? And unless you know that, which to be honest, you're probably not ever really going to know, I would highly caution you to not just jump into surgery. So that is reason number one. Surgery fixes the structure. It does not change the mechanics. So this sort of brings me into reason number two, why you're still in pain after a labral repair surgery, is that you did physical therapy, but it was very generic and it never gave you a clear strategy of what to do to actually fix the mechanics and move forward. So most of the time you have your surgery, you go into your standard physical therapy practice, and your therapist maybe spends 15 minutes with you. They put you with an aid. They tell you to do these exercises. We got to get you stronger. Once you get your range of motion back, it's like, okay, let's work your glutes. Let's get your glutes stronger. Let's do some bridges. Let's do some clamshells. Let's do some lateral band walks. Sound familiar? These are the things that are given over and over and over again. The problem is that physical therapist very likely did not actually walk you through a clear framework of what to do before you got to that strength phase, because there are some things that have to happen before that. If we jump ahead to strengthening, very often you are still going to end up in pain and back at square one. And more than that, it never addressed the root of what the problem was before you had surgery. Okay? Because again, maybe we need surgery for structure, but there's still a functional component there. And if it wasn't ever addressed, that functional component was never addressed, it still has to be addressed after surgery. And if it isn't addressed after surgery, you will still be in pain. 100% you will still be in pain. Maybe not immediately, maybe not 3 months, but a year down the line, further, the pain's going to come back. And that can be frustrating. So I'm trying to save you guys from months and years of frustration here. This generic physical therapy, it doesn't follow this clear framework. So what should a good framework look like? Well, I'm going to share mine with you. This is what I walk all of my clients through, whether they are working from a self-paced course with me all the way up through one-to-one care. And if you've been following me for a while, you should know this framework because I talk about it all the time. So the way that I sort of go about this is called the core framework. So the first phase is the C, which is calming, and understanding your body. So this is the phase where we figure out how do we actually get you out of pain. Now again, post-surgery, there's going to be some post-surgical restrictions. So how do we get your pain level down? Because if we try to jump into strengthening when you're guarded and in pain and inflamed, it's not going to work very well. But even if you haven't had surgery, you still have to do this phase. We got to calm everything down. You also need to understand how your body is working, what's happening in your body. Is it structure? Is it function? Like all these things that I've sort of talked about. It's really good for you to know what a labral tear is and what impingement is, because all the other exercises and everything we do further down the line is going to make so much more sense. And I would argue that most physical therapists never explain this to you. So if that hasn't been the case for you, I'm sorry. I'm glad you're here now. We're going to talk about it. So again, the C is calming the symptoms and understanding what's going on in your body. The O is optimizing movement. So this piece is so crucial before we jump into strengthening, because yes, strength is important. Yep, we need glute strength, all that good stuff you've heard. But has anybody ever taught you how to do those exercises? How are you supposed to be moving with good patterns? How are you supposed to move so that the head of the femur stays centered in the socket and it doesn't drift forward and give you too much anterior compression and stress and pinching and pain and all the things that you're feeling? How does it stay in a way, how does it move in a way so that the front is coordinated with the back muscles so that you're not getting that deep glute pain anymore? There's so much that goes into movement patterns and making sure the hip is such a cool joint. Like I love the mechanics of the hip joint, and everything sort of has to work in harmony. And if it's not, and it's not working in sync, again, you're going to jump into strengthening, which is typically what happens. We push forward into that strength phase as soon as the pain is gone. But if you've never learned how to move, as soon as you add load back in, the pain's going to come back. And again, this is something I hear all the time, whether people have had surgery or not. I feel good. I'm working with my therapist. All is good. And then anytime we try to progress and add load or intensity, my pain comes flaring back. And we just do this back and forth. And I've been doing this for a year and I don't know what to do anymore. That is all too common. And I can tell you the reason that it's probably happening is probably that you never went through this framework. You never learned how do you calm your flare up? What are the things that I call them your non-negotiable exercises, the things that feel the best to your body? How do you listen to that and know what it needs? And they never taught you how to move. So as soon as you add load on, you're not doing it with good mechanics. You're probably starting to compensate. That pain comes rushing back, and now you're in a flare up and you also don't know how to calm your flare up down. And so now you have to rest and you have to wait it out. And then you just start the whole process again. And this flare loop of flare, rest, pain, like it goes on for years for people. And it doesn't have to if you just work with somebody who understands how to teach you this and how to walk you through this program. So, and again, unfortunately, most generic physical therapy and traditional physical therapists are not going to do this. I didn't learn this either in school. I've learned it because I've worked with people for 14 years who are struggling with this issue. So find somebody who can walk you through this. And if you don't know who it is, you know where to find me. And then I think, there's one more stage in my framework, the E, which is elevate performance. That E, or I guess I don't even think I said what the R was. R is rebuild strength. So we optimize movement. Now we've rebuilding strength. But then elevate performance is, what about like normal life, right? Getting back into the demands of life. Maybe you want to run again. Maybe you want to be able to walk your dog for an hour. Maybe you want to jump, whatever it is. You have to be able to layer on the challenges on top of the strength and the mechanics that you've built. And again, unless you do that, the pain is going to come back. So it's so important that you walk through the entire framework, not just, I'm going to get myself out of pain and be done with it. No, if you get yourself out of pain, but you haven't relearned movement, strengthened movement, and challenged it a little bit, you are going to end up at some point back at square one, and you're not going to know what to do to get out of it. Hence this cycle that people, this loop that people get stuck in. So having somebody that can walk you through that framework is key. And again, if you don't have it, it's probably the reason that you're still in pain after surgery. All right, let's talk about the last one. Number 3, the third reason that you're probably still in pain if you've had surgery is that your nervous system is very likely still overprotecting your hip. So for a lot of you guys that are listening, you probably have been struggling with pain, and who knows, maybe you had surgery recently, maybe it was a long time ago, but you've probably in one way or another been struggling with this for a long time. That means that over the course of these couple years, months, weeks, whatever it is, your body has learned how to protect itself and how to guard and compensate and change the movement so that things feel a little bit protected and better to you. Our brain wants to avoid pain. It doesn't want you to feel pain. So it learns to move. Our body learns to move in ways that protect us from feeling that pain. Your nervous system is part of that equation. So basically your brain says, I don't want to feel pain. And it tells your nervous system like, hey, let's guard up. Let's make sure that that muscle is protecting that hip really well. So we're just going to tense everything. And now we end up with all this reflexive muscle guarding. And that itself right there can cause more pain than the labral tear ever could. So if you don't learn how to relax that nervous system and retrain it post-surgery, again, we're still going to end up in pain. All of the things that you would need to do from a conservative perspective prior to surgery, like if you opt to not have surgery, are the exact same things you need to do on the back end if you do have surgery. And calming the nervous system is one of those things. You have to get your body out of this protective cycle, this fight or flight response of sometimes it's protecting because it does hurt to move a certain way, so it's going to guard up. Sometimes it's doing it out of habit. It remembers pain and it's like, oh, I don't want to feel that again. So I'm just going to tense up and guard so that it doesn't hurt. And I'm going to protect myself from doing these movements that might cause a problem. And again, this is going to cause a lot of problems. It's going to cause you, if you don't figure out how to fix that, surgery and changing the structure is not going to fix your nervous system. What will fix your nervous system is learning how do you calm it. So working with your therapist on maybe making sure, one of the early things that I often do with my clients is deep breathing. That's a really great and simple way to start to reorganize the nervous system and have it, kind of melt away some of that guarding that you're having. And that really is only step one, right? Because just because you can diaphragmatic breathe and relax during that specific point in time doesn't mean it's going to carry over into functional activity. So how do you find relaxation and down training of the nervous system and then be able to incorporate it back into movements that slowly feel safe again to your body? So rebuilding trust in your body and with what it's capable of is a huge piece of the puzzle. And this sort of all goes back into like reason number 2. I was talking about that core framework. This is all built into that core framework when you're working through a strategy that's really effective for post-surgery, or even if you haven't had surgery. This nervous system retraining should be ingrained into almost everything you do. Because let's take the example of a squat. For a lot of people, they feel a lot of pinching and discomfort in the front of their hips when they squat. So you go into a squat and over again, every single time you squat, which we do all day long, getting up and down from a chair, the toilet, the car, like all these things, that's squatting. And your body learns that. And it starts to realize, gosh, every single time I flex my hip and I squat, it really hurts. So I'm just not going to do that anymore. Well, the problem is you still have to be able to squat every day, right? But every single time it sends this signal and your body tries to compensate around it. Maybe it tenses a little bit more where it shouldn't. Maybe your back starts to do a little bit more of the work. Like weird things start happening to try to protect you. And when it starts to do that, it starts to layer in like these are the new patterns of how my body moves now. This is my new normal. And maybe I don't feel as much pain, but I'm also compensating and doing all these things that are now creating maybe some other issues now or down the line. And so we have to be able to layer on and teach your body, hey, it's actually safe to do that movement. So maybe we start with some diaphragmatic breathing and figure out how can I let go of that protective guarding. Then maybe we're going to go into a hands and knees rock back of, hey, look, you can flex your hip, not against gravity, and look, it can flex and it doesn't hurt. And it's basically every time you do that and you teach your body, oh, wait, you're flexing. It doesn't hurt. It's like putting a coin in the trust bank. Oh, you can trust that a little bit more this time. Oh, that's a little bit hey, you know what? Before long, flexion doesn't hurt anymore. Maybe it still hurts when I'm standing, but I can do it this other way. Okay, well, then the next step is how do we get you to be able to do that when you're standing so that it doesn't send you into fight or flight every single time you have to sit down in a chair? And we just layer these things on and we build trust over time. That piece has to take place whether you have surgery or not. And especially if you have been out there and you've been struggling with this for years, which I know a lot of you have been, that nervous system, those patterns are ingrained and it takes a long time. This is not an easy flip a switch and it's better. It's a lot of repetition, a lot of consistency to really start to see some changes take place here. It is 1000% possible, but you have to be willing to put in the work. And you also have to find somebody that can walk that journey with you and teach you how to do these things. So those are, without a doubt, the top 3 reasons that I see people that have had labral surgery that are still in pain. So number 1 is the surgery fixes the structure, but it does not change anything about how you're moving, mechanics, nothing. It never addressed that cause. Number 2 is you did some generic physical therapy, but they never gave you a clear path and strategy forward of how to progress yourself through this process. So you keep ping-ponging back and forth between pain and resting and flare-ups and all these terrible things. And number 3 is your nervous system is just overprotecting that hip, and we need to re-regulate it and downtrain it a little bit. So I hope that was helpful for you guys. Again, I do want to stress, I'm not anti-surgery by any means. I think there are absolutely times where surgery is the appropriate next step for people, and there are times where surgery does eliminate your pain. But for the vast majority of people who have probably been Googling at 2 a.m. and landed on this podcast or this YouTube video, however you're watching, it's probably because you had the surgery and you're still in pain. And I want you to know that there is absolutely a way around that. You just haven't been shown the path forward yet. So I'm glad that you're here. I'm glad that you found this. I promise there is a way out of this pain loop. If you are somebody that's debating having surgery, I hope that you've listened to this all the way as well, because these are things that I think are really important to know going into surgery to better manage your expectations of what's going to happen on the other side of it. And the cool thing is, all of these things, if you do start with conservative care, all of this, if you address it before surgery, the worst that happens is, okay, I still have to have surgery. It didn't help me avoid surgery or delay surgery. Okay, fine. But guess what? Now when you come out on the other side, you've already learned all of this. So now you are just rehabbing in a way that makes sense. And you're not necessarily, yes, there's little things you're going to have to relearn about your hip and how to move it again and downtrain the system and all of that. But you've already learned it once. So it's like riding a bike. And now you just have to remind your body of how to do it and make some little tweaks along the way. But if you learned it before surgery, again, okay, you have to have surgery, but now the hard part really has been done and you just get to go to work. So either way, whether you've had the surgery or you're thinking about it, I hope that this was helpful for you. If you guys have any questions about this, and moreover, like what it actually looks like how do I actually implement this core framework? Maybe your therapist isn't doing this with you, but you want to be able to learn how to do it. I'm going to link some information below for you guys in the show notes. Not only do I have a self-paced course that walks you through the process of how to do this, but there's also lots of different ways. I've got a free webinar that talks about it. There's all kinds of ways that I can help you guys understand that, even if it's not feasible for you to come and work with me in person or virtually. So either way, I just want to make sure that you guys know that you're supported. There is a way out of this pain, and I hope to connect with you guys really soon. I'd love to hear from you as well in the comments section. If you've had surgery, where are you currently at? Did it help? Did it not help? If you're thinking about having surgery, whatever's going on, let me know in the comments. Let's get a convo going, and I look forward to seeing you guys back here next week on Unchoreographed.